So tonight we are doing an educational meeting and are so pleased to have with us our guest presenter to help us learn more strategies for managing memory. Dr. Melissa Brie is a neuropsychologist, and that is a psychologist who specializes in the relationship between brain and behavior. She helps patients develop strategies for adapting to ongoing cognitive issues, and those involving thoughts, perceptions, and reasoning abilities, and provides assessments to help patients better understand their cognitive changes and develops individualized treatment plans to improve quality of life. Dr. Brie earned her Doctor of Psychology degree from the Wright Institute, and she completed a UCSF fellowship in neuropsychology training at Zuckerberg San Francisco General Hospital and Trauma Center. Dr. Brie's research focuses on tracking cognitive changes experienced by patients with brain tumors and determining the best treatments for improving cognition and enabling patients to return to their daily lives. So, Dr. Brie, I am going to now turn it over to you, and I think you're going to be sharing your screen. I'm going to spotlight.
Wonderful. I'm happy to. Thank you, everyone, for joining me today. I'm really happy to be here. Can you see my screen okay?
Yes, we can.
We're looking good? Okay. All right, excellent. Well, thank you for being here. I apologize that I missed the last session. I got a really bad cold, this one that's been going around, and I was so sad to have missed it, but I'm so glad we were able to reschedule, and then I'm able to join you today to be able to go over some of these great memory strategies that we have. And as Naomi mentioned, I do work very specifically with folks who have a lot of cognitive changes. So this is really what I'm working with all the time, people who are living with brain tumor, have experienced some sort of cognitive change, and more often than not, memory being one of those, feeling more forgetful. So we have a lot of different strategies that we know can be really helpful. And so I'm going to introduce those to you today. I also am lucky enough to have one of the patients that I have worked with, Jonathan Widener, is going to join me today in helping explain some of the strategies that he's been using in particular. And so he will be the patient voice along with what I'm helping to provide today to teach some of these strategies to you. So I'll have him sort of chime in as we go and give his perspective and maybe some tips and tricks that he has learned and implemented through our work together as well. So I think with that, I'll go ahead and begin. So what I wanted to sort of first start with is learning objectives, just to kind of set the stage a little bit, organize us. I'm going to go briefly over what are some of the common thinking changes to memory, cognitive symptoms that we often see that are related to experiencing brain tumor and the related treatments to that. We're going over some tips and strategies for managing some of those thinking changes, and then maybe some, resources or tools, things that we know can be helpful, especially when thinking about how to manage memory. All right, and really, what we see is common in this population, because not only is experiencing cognitive changes pretty common for folks going through cancer in general, but those especially, as you see here with what they are saying is, central nervous system tumors, which would be brain tumors. If you can see this bar chart, much more likely to experience cognitive changes than any other group that is going through cancer. So we really wanted to make sure that we had resources provided for folks that were specific to cognitive changes, because this is really common. Not everyone's going to experience it. I'll say that too. Not everyone will. Everyone's different. Everyone's experience is very different. And at the same time, it is pretty common to have at least some mild changes to more significant changes, depending on tumor location, types of treatments. Everyone's just the way that your brain is laid out, all the different things that might make us individualized in some ways. There might be some individual differences, but it is pretty common to see some sort of thinking changes with this particular disease. And, you might notice that the changes you experience change over time. There might be times where they are not as bad. They might get worse with time. It might depend on where you are in treatment cycles. There can be fluctuations depending on sleep, or if you're, on chemo versus off. There could be improvements pre or post surgery. There's all these different changes that can happen, or even just from a good night's sleep that could make a big difference. So it's something to think about, that there's changes over time. There can also be these fluctuations that occur, and to think about how this ends up being sort of a management process. We're going to figure out ways to learn about what works best for you, because there might be times when things get harder and there might be times when things are easier, but you want to have all these tools in your pocket setting you up for success no matter what the situation is. The common areas we see changes are usually in attention and concentration. I see that pretty much across the board. Almost everyone that I talk to has increased distractibility or more trouble concentrating, being able to focus on what's going on around them. Memory is probably the other one I hear the most. Executive functions, which is things like the complex stuff that we have to do, the planning for things, organizing, problem solving, all those things that take a lot of mental energy and take a lot of different types of parts of your brain. It's a really complex activity. Those networks can get disrupted, and that's another one that we see commonly impacted. And then processing speed, being able to quickly think of things, quickly think through it. You might feel like your thinking is a little bit more sluggish. That's another thing too, with these connections that are in your brain. There might be some changes in the way those connections are talking to each other that might be impacting some of these different domains. And a lot of different things can impact how cognition, those fluctuations we talked about, or how this gets impacted in general. For instance, your level of education, that what we call it cognitive reserve coming into it, that might play a factor. Any other premorbid conditions, mood makes a big difference. Whether or not you're feeling okay, if you're stressed or overwhelmed, or you might have lower mood or depression, that can make it really hard to think clearly. It can make it really challenging to do the things that you used to do if you have these mood symptoms that are making things harder for you. The location of the tumor can make a difference, especially specifically things like if your speech areas are impacted, language symptoms much more likely to be prominent then. But overall, those things like attention, executive functioning, all that kind of stuff that's more of your whole brain, like network-based kinds of activities, we see that pretty well across the board, regardless of the tumor location. Fatigue's a big one. We see a lot of people struggling not only with physical fatigue, but mental fatigue is really the one we see a lot. That cognitive fatigue, feeling like you're kind of petering out, losing steam toward the end of the day, especially, that you've used up all of your cognitive energy, and it makes it really hard to think under those conditions. So managing your fatigue can be a really big piece of this puzzle. And we'll talk a little bit more about that too. And it's really common. I just want to point out too, 92% of people that they found in this in this study, you have some sort of changes in mood or behavior. So it's really common to have some of these overlaps, and figuring out ways to address those might be part of how you can overall help your cognition as well. So some of the guiding principles based off of that, then, before we even jump into strategies, is what are some things to make sure you're set up for success? This idea of we're treating the whole person, right? We want to make sure that you're taking into account all the different things that might be impacting your ability to think really clearly and perform at your best. One of them being fatigue, like I mentioned, managing your fatigue, a big part of it, working with your treatment team to see if there's anything medically that they can do, or rule out any other conditions that might be on board, anything related to inflammation or the going on and off of steroids, anything like that, or is your sleep been impacted? That's one we see very frequently too. How's your sleep doing? Are you getting 7 to 8 hours of some pretty good quality sleep? If not, that might be the area we start with before we even get into anything else, because it's not going to be easy to do these other strategies if your brain is tired all the time. So we need to kind of get some of those things in place first. Developing and implementing systems to get things done. We're going to talk about that in a little bit more detail, but systematizing, creating a routine and structure. Almost everyone I talk to, we're setting up some structure. We got to get some structure in. We need to relieve some of the external things that are creating extra work and extra complications for your brain to really think through. If you take some of those, those experiences that are creating a lot of work for your brain out of the picture and make things more routine, it's going to be easier for your brain to function in those circumstances. being present during tasks. We're going to talk about why that's so important, and learning from successes and challenges, going through and learning about yourself. Where are you at right now? We're going to talk about how important that is to get an idea of how things are impacting you right now, what tends to help, what's not as helpful, taking that information and using it to plan moving forward. And knowing your strengths coming into it. What is it that you tended to lean toward for memory before all this happened? When you were in school, for instance, how did you study? Did you need to listen to something? Did you need like audiobooks or things like that? Was it more helpful for you if you saw pictures, if you did both, if you wrote things down, was that easier for you? All those things, like whatever it is that you noticed was helpful before, try leaning into that potentially. Know what your strength is going into it, learn about your strengths. That's part of this process of learning about where you're at right now. Consider feedback from others. Sometimes we're not always aware of some of the things that are helpful or how things around us are impacting us. And it can be helpful to have loved ones, friends, family, other people that you interact with give you some feedback of things that they're noticing. Like, oh, you know what? I noticed that you were forgetting a lot more of your words after we went and had that big party with family and there were all those kids there. There was a lot of noise and you were pretty tired. You had a really hard time getting your words across that night. Okay, that's good to know. Maybe that was a particularly mentally fatiguing experience. And maybe next time when you're planning for a party or something like that, maybe you need to think about taking breaks during it, going and sitting in the car or somewhere where you have some quiet. You can take a brain break, shut out some of the stimulation, maybe go for a shorter period of time. Things like that you can plan ahead next time so that you're not experiencing some of the same symptoms or having what we call like a cognitive symptom flare up as a result. And when possible, include the support system around you in your plan. I think Jonathan will speak a little bit to this later too and how it was helpful. But it can be really helpful to have other people around you know what your tools and strategies are so that they can assist in them, but also so they can understand when you're trying to communicate something, why something is happening the way it is. It just makes everything, the transparency, the clear communication can be really helpful when trying to do some of these strategies. I wanted to first start with a little plug for ourselves. We recently, if you haven't seen it already, we recently put together this really lovely manual, Living Well with Brain Cancer, Cognitive Strategies. It's posted on the Brain Tumor website, and I have the link, and I even did a QR code at the end, which was pretty fancy for me. So you guys have the QR code at the end if you want to just link to that. But it's posted online as a PDF. There's hard copies in the clinic if you would like a hard copy. It came together really nicely, really pretty package here. But that's how I'm going to sort of set the stage of what my presentation is today. Is I wanted to sort of walk through how we put the managing memory section together so that when you have those notes at home, whether it's the PDF or the hard copy, that it will it'll resonate with what we talked about here. Like, oh, that's right. We were talking about this and I see these notes here. So I'm going to walk through and explain a little bit more about what we presented as the managing memory section in here. And then I also have some additional tips at the end that just some other concrete types of things that if we get to that at the end, I wanted to be able to make sure we include it as well. But I'm going to sort of frame it around this. So if any of you guys have this already and you want to reference it in some way or have it with you, feel free to grab those. I'm going to be kind of walking through this particular document a bit. So what I was mentioning before is this getting to know you part. Where do I even start? How do I start learning how strategies are going to help me? Which ones are going to be best? What's worth putting effort into? And what's going to have good payoff? What's worth my time and my energy? Let's check out where you're at now. This really involves a tracking sort of process. It's increasing what we call self-monitoring. I really want people to start looking at what things really help them, what things work and don't work, and what tends to be going on, really reflecting on what's going on when you have those forgetful moments. So we have in that little booklet that I just showed you, we have a tracking sheet that you can use or something similar to it, but it looks just like this, where start to write stuff down, take some notes. I'll say one of my takeaways, I'll repeat this throughout, is write stuff down, whether it's actually writing or talk to text, something, putting information down on paper, your phone, anywhere else, and getting it out of your working memory space, getting it out of your head and onto something you can reference is such a good strategy. And people, I've noticed a lot of people I talk to have concerns about that. They're worried that if they do that, that somehow will make their memory worse because they're not sort of forcing themselves to remember it. And that's not true. That's actually not how it works. And we'll go through memory a little bit. That's absolutely not true. It's not going to make your memory worse. It will actually really improve your memory systems to have the what we call multimodal, different ways of incorporating information, writing it, saying it. All those things actually helps with memory. So write it down. So take some notes when things happen is my point. When things are going on, jot it down in some way. So you're like, oh gosh, I had what we call a cognitive slip or a cognitive symptom. What happened just then? What was going on around that time so you can learn from it. So for example, they're like, what happened when I was being forgetful? So I forgot where my keys were when I needed to leave the house. So what was it that didn't work? Reflecting back on it, you know what? It would have been helpful actually if I always had one spot in the house where they were, because I was looking all over for them, and it could have been anywhere because I generally put my keys in different places, so it could have been anywhere. So if I had used a strategy of putting my keys in one place all the time, then I would know that my keys were there and I would just have to look there. Now I'm going to try that strategy. Next time I'm going to put it down in the one spot I designate and see what happens. So what happened? What did you change? Was it successful or not? I was able to get out of the house sooner. I wasn't as stressed probably. I didn't feel as flustered. Whenever you're stressed or flustered, you're going to have more cognitive symptoms. It makes it really hard to think clearly. So anything you can do to reduce pressure situations, feeling like you have to think on your feet, or when you're feeling in a rush, whenever you feel like you're in a rush, that's going to make it really hard to think clearly. So if you prepare ahead of time by having a spot, you always keep things, that sort of reduces that stress and makes it much easier to think through. All right. So with that in mind, let's kind of take a step back. How does memory work? This is a really simplified version of this, but I bring it up because I think that this conceptually, if you think about it, helps you to understand why some of the strategies are helpful. So if you think about what memory is, really what memory is you're taking in information, whatever that is, and you're hoping that it gets stored in your brain so that when you need it later, it comes up for you and you're able to use that information. So what that process really is what we call encoding. You're taking the information in, information comes in, whether that's something like stimulation, like you're, feeling or hearing something, or it's someone talking to you, what I'm doing right now, you're listening and you're taking in that information. Then what's going to happen is a process of consolidation. So you take that information and your brain organizes it, files it away. I always picture a little filing cabinet. For some reason in my brain, it's a little card catalog from like the 1970s. That's my particular memory. Everyone might have their own image of this, but I've got a little, Dewey Decimal System happening in my particular brain. Then you're going to have the storage of it. You get that information. You want it stored in that long-term area. You want to have somewhere where it's holding all that information that you're taking in. And then that last step is you really want to be able to take that information out. After it's stored, you need to be able to access it later. So all these different steps, there's ways this can get interrupted or can be less efficient or more efficient. And so we want to look at ways to improve these different steps so this process works better for you. This process can be a bit disrupted, especially we find mostly on the front end, the encoding. This is where we see people's attention, like I mentioned, not being able to pay attention and focus and concentrate for long periods of time, that part might be harder. And so information's not getting in to begin with, or the back end. We find a lot of people have trouble finding the information once it's in. So in that case, usually it's a matter of maybe something didn't get stored correctly. Maybe it's not organized in their card catalog system to be able to reach it when you need it. It's not filed under elephant where you thought it would be. Actually, it's filed somewhere else under penguin and you don't know why. Whatever it is, the system didn't work quite right. And so that's two of the areas where a lot of these strategies fit. So I just wanted to give you that sort of framework to say why it is that we are recommending some of the things that we do. So first step, memory requires attention. That is the first step to all that information getting in, being stored, being useful. So in order to get that information in, you first have to attend to it. There needs to be that focus. So if you can improve your attention, you're going to improve your encoding. And ultimately, the hope is you'd have better memory. You'd reduce that forgetfulness. So one thing I recommend to everyone is doing what we call present-minded exercises. That's mindfulness, really, but we call it present-minded because we're really trying to help you focus more on the present, strengthen your attention to be able to stay in the present instead of having your attention kind of pulled in a bunch of different directions. Being able to stay present and focus is a skill. It's something you have to strengthen. And oftentimes that's the thing that has you've lost a little control over in some way through some of these changes. And there is a way to strengthen it. It's something that you can rebuild and strengthen with practice. Practicing present-minded exercises or a mindfulness practice can do that for you. So a daily practice of it, consistency matters in this case. It's really helpful to have consistent practice, 3-5 minutes a day, not a ton. You can do things like listen to an app. Headspace has a bunch of different exercises. There's even a focus section on it that I like the folks on there and some of their exercises. Calm had a lot of people have been using that one, and I've been hearing good things. Insight timer, any of these things where they're asking you to focus on your breath, that brings you into the present. Your focus, your attention has to be in the present. Something that's called a body scan, where you have to focus on how your body feels. It's focus on your fingertips. How does that feel? What does it feel like to have your feet rub against your shoe or feel your feet on the ground? Any of that where it's getting your focus back into the present. Practicing that, you'll start to notice that you're able to stay more present and stay more focused. But there's a sort of a practice up front, just like exercise or anything else, where you have to kind of do it consistently to see the benefit that you start to do. So I really encourage people to start this mindfulness practice. Doing these present-minded exercises can really pay dividends for just a few minutes a day. So attention strategies to improve memory. In addition to present-mindedness or those mindfulness strategies, reducing distractions. Whenever you need to concentrate for whatever reason, you're sitting down to pay some bills, or you need to have a conversation with your doctor, something like that, go to a quiet location. Reduce noise distractions, reduce visual distractions, remove clutter from your desk or the area where you need to focus. You can use noise canceling headphones. I recommend that to a lot of people. Noise canceling headphones can be super helpful too in reducing cognitive fatigue. It's taking out some of that auditory stimulation that is, churning away at some of your mental energy. Pop on some noise canceling headphones, give yourself a little break, let your auditory system calm down for a bit. Simplify things, prioritize them, and do one thing at a time. Break things down into smaller chunks that you can focus on so you're not feeling pulled in so many different directions, and do one thing at a time. As much as we think multitasking is the way to go, that's why our culture has decided that that's the ultimate, but it really has. It's not as productive as we think it is. And we usually aren't doing the best work we can under those circumstances. So try to figure out what the one thing is you need to focus on in that moment and do that thing to completion before doing something else. In conversations, asking clarifying questions can help you stay engaged, so that can optimize your focus. Noticing, again, this idea of starting to monitor how things are going for you, that self-monitoring. Where are you at right now? What are you noticing about forgetfulness? Starting to notice when you get distracted. How often is this happening? Is your thinking on what you're doing? Those two things aren't always happening. You might be doing things and going through the motions, but you're thinking somewhere over here. Pulling your attention back to the present, which is what those exercises help you do, the present-mindedness, is going to help you focus on what's going on, which will help you take it in and remember it better. So noticing when you're getting off task, noticing when you've gotten distracted, pulling your attention back. So stopping, focusing, returning to what you're doing. A lot of people find that if you work on the more complex things in the morning when you're freshest, because most people say that they have more cognitive energy in the morning, maybe doing the most complex thing first or the most important thing first when you have the most attention, and then maybe letting other things go till further in the day when you don't need as much attention. Using a focus phrase for being able to say like focus up or something to kind of get you back in the game, or actually, talking to yourself about, stay focused, something that re-engages you in your task. And practicing these relaxation mindfulness exercises. Mindfulness is so critical. I hear that from so many people. I'm sorry to keep belaboring this, but it comes up so much. So many people have benefited from doing that. It's really something I want to make sure everyone is aware of. And also, it does tend to have this side benefit of being really relaxing. That's not why I'm saying to do it. It's helpful because I don't want you to be stressed. It's really hard to think clearly when you're stressed, but the purpose is to use the skill to be able to refocus into the present when you need to. But it tends to be relaxing and you usually feel better afterwards. So it's kind of bonus in that way. So also in terms of attention, thinking about attention also as more active. You want to be actively engaged in something. If something is more passive, you're much less likely to remember it. So part of thinking about these like multimodal techniques to memory is helping you to be more active and engaged in what you're doing. So one of the things I thought was really interesting that I came across was these statistics here of if you read something, you only remember about 10% of it. If you're hearing it like I'm doing right now, 20%. So maybe if you're doing a read and hear together, maybe some more of this will stick as you're reading the slides. Observing only about 30%, observing and hearing about 50. So maybe this one will fall there. We're about half of it. Discussing it, like if we discuss this afterwards, you're much more likely to remember it, making it more personal and starting to do that consolidation process we talked about. But experiencing it's way up there, 80%. If you are actually experiencing something, someone's teaching you something, you're showing you how to do it, you're doing it in the moment, and you're actually practicing it together, you're much more likely to remember. And then if you teach it to someone else, like bingo, that's 90%. That means you've really consolidated it. It's organized, it's in your long-term storage, and you've been able to retrieve it and share it with someone else. That really helps that whole loop close, and you're able to remember much more. So thinking about that, if you're trying to remember things more, you might tap into these different multimodal techniques. You might both read along with something and listen to the audiobook, for instance, or you might have someone show you how to do something instead of telling you. You might then teach it back to them. There's a process called teach back where if someone's telling you something, you might say, let me see if I understand this correctly. Is this what you were saying? And repeat it back to them. That's going to help deepen your learning of it and help you remember better. So here's where we're going to kind of transition into the booklet that we have put together and the tips we have for managing memory. And I was just going to show you, this is the page I'm starting to go through. So I'm sort of referencing it if anyone has it open. But this is not readable. That's the size it is. I've made it much larger, and we're going to go through it a little bit step by step. But some principles to sort of think about. One of it is making it personal. You're much more likely to remember something if it's personal to you in some way. If you associate it with something you've learned or something you feel or a memory you have already, if it's associated with you and it's more personal, it's more likely to stick. So for instance, associating new information with something that's already known. So if you meet a new person, for remembering names, you might associate a name with someone you already know. This one, it's giving the example of Alice. If you meet someone named Alice, you might picture them wearing an Alice in Wonderland dress because you associate that dress with that name Alice. That's something that's already known, and so you could tap into that a little bit. If you create an emotional connection, you're much more likely to remember it. Our brains are designed to really tap into emotional memories. That's one of the reasons why those big like light bulb kinds of experiences in our lives stick so well, is that once the emotional side is turned on, our brains go, oh, this must be important, and really lock it in. So if you make an emotional connection to it, you're more likely to remember it. So if you can have a personal feeling relating to it, you're much more likely to remember it. Or if you do something creative with it, if it's something is routine and really rote and you're just doing it over and over again, it becomes more passive. If you do something more creative and kind of change things up a bit, you're more likely to remember it. So for example, if you can't remember where you parked your car because you go to the same parking lot day after day after day, you go to the same grocery store, you go to the same workplace, maybe the next time you go, you sing a silly little song, or you get out and do a little skip or a little jig before you leave your car. Do something different or creative, you're more likely to have it stick in your brain. You start to engage your active attention, you're noticing the things that are different in that moment, and that will make it easier to remember later. Okay, the other sort of technique we talk about, so that was making it personal. Making it clear is really talking more about, oh, I'm sorry, I'm just realizing I just completely passed up Jonathan's part over attention. I'm sorry, Jonathan, I'm just realizing I skipped over the attention piece. We're gonna go through make it clear, and then I'm gonna circle back, okay? I apologize, you guys. I wanna make sure that Jonathan's voice about the attention piece, because I know he had a lot to say about that. But making it clear, I'll just say this really quickly, we'll come back to this one, is that, again, kind of doing things when you're more alert, when you're more cognitively fresh, so you're thinking clearly, you're putting your best sort of cognitive foot forward, as it were, and making it really clear when you need to do things, setting alarms, setting timers, making things really, having them come to you where you're not having this gray area where it's really clear at this time, I need to do this certain thing and there's not any guessing around it, can be really helpful. Let me circle back with that in mind to the mindfulness piece just for a moment. I apologize. I wanted to make sure that Jonathan was able to speak a little bit to this, because I know that he in particular uses these apps and found them really beneficial. Jonathan, are you able to, there you are, hello. Yeah, I wanted to make sure you could do a little introduction for yourself. And if you wouldn't mind sharing a little bit your experience with present-mindedness and attention and some of the things that you learned about how important that is for memory and forgetfulness, especially.
All right, perfect. Thank you. Hey, everybody. So just a little bit about myself. I'm a two-time brain cancer survivor. I'm a patient at UCSF Neuro-Oncology with Dr. Oberheim-Busch. I've had two brain surgeries, one in 2013, where I also had radiation, and in 2018, where I had a little bit of chemo, but I didn't finish the chemo process. I did have some pretty cognitive issues with the second brain surgery especially, but it did stop the seizures, which was really nice. So I haven't had a seizure since 2018. I'm 49 years old. I currently run a nonprofit in San Diego called Love Linda Vista, as well as I'm a town council board member for my neighborhood of 38,000 residents. I'm very open about my brain cancer. So it helps me have a better betterment of the cognitive abilities that I'm trying to challenge myself with by being open with my colleagues. And it's very rare that I ever have negative feedback. Most times the feedback I get is, oh, I've had that happen to me before. I forgot that too. Or and it's really good to be open about what you're going through, because you'll get further in your challenges and you'll find a lot more people that will help you practice, which was such a huge thing for me in the ministry, in the memory strategy program that I went to it was like a 6-week, 7-week program with Dr. Brie. One of the things she mentioned was attention is key to your internal and external, what is around you. She mentioned something really recently that just happened to me was like parking. So recently I was parking in a parking structure and it's coded in yellow, or every floor is coded in a color. And the color I parked on was yellow. So when I got out of the car, I started singing the song Mellow Yellow. And I remembered it for the next 3 hours that I was parked in that spot, because I went shopping in a big mall and I knew exactly where I was. And so that really helps a lot. As for the mindful staying present, it's essentially just kind of meditation practices. It's, just kind of sitting quietly in a room and just letting yourself not hear anything. One of the great things that I learned in doing it, someone told me, imagine like every thought that I had, that when I had that thought, to put it on a little boat and put the boat in a little stream and let it float away. And then the next thought and the next thought. And you just keep doing that until almost your head is completely empty. And then the interesting thing is that's whenever you start hearing the little birds outside that normally you don't necessarily hear throughout a busy day in a big city. That was really helpful. let's see. I'm actually I'm using my notes here. This is my other method. We'll talk about that a little later. But I'm reading through my notes of things that I wanted to share with you guys. Another great thing that I do that she mentioned is using noise canceling headphones. I use my AirPod Pros, and I put them in my ears when I go to the grocery store, even, so that when I shop, I don't get really distracted by people around me, you know, baby crying, or, you know, a deli person talking to the other deli person. That way I can focus on exactly what I need to get done. And, you know, no one seems to mind. And I actually notice more and more people wearing earphones out all the time. And a really good friend of mine told me not to worry about it, because a lot of people who have anxiety do the same method. So that sort of made me feel like, oh, I can actually do this and no one's really going to care. But she mentioned two apps that I use all the time. One is Calm and Insight Timer. Both of those work really well at teaching you how to calm yourself. They also help you. They have, in the Insight Timer, for instance, well, Calm as well, they have the ability to help you fall asleep. And as she mentioned, sleep and awake time both need to balance out really well, and allow yourself to understand that you're going to get more tired than other people, than you used to. And that's okay. I take naps and I'm not ashamed of it. And I run a nonprofit, and all my staff that I work with, they know that I need a nap. And so they know not to call me between 1 and 3. So, and that's okay. So that's where we are with that part. And take it away. I'll call me when you're ready.
Thanks, Jonathan. I appreciate that. Really, really helpful. I appreciate all your wisdom that you've gotten from some of this, and really good tips. And I think that's really helpful to bring up too, that this is something that a lot of people struggle with for a lot of different reasons. And it might be that the things you're worried about, other people sort of knowing about you or discovering, that it might not be as big of a thing as you're imagining it might be, and letting people into your world a little bit of things that you need and advocating for that could be helpful in some of these circumstances. So I really appreciate that, Jonathan. Thank you. And we'll have him rejoin and talk about his notes and things that he was showing you in a little bit here too. So going back to, let me just move forward a little bit, making it clear, as I mentioned, we'll reset a little bit, that, you know, doing things when you're more alert. Hopefully, maybe you used Insight Timer to help you get a good night's sleep. You're feeling really good in the morning. You're feeling clear. Maybe you did a nice walk and you're feeling refreshed and awake. Doing the things that are more complicated during that time might be helpful, as your memory might be working better under those circumstances. Using reminders is key. That is part of any kind of memory strategy, is having a really good system in place. We're going to talk about that from a couple different perspectives. How to develop a system that sort of helps you. I used to work in like contracting world for a little bit, that you can like subcontract out to these other devices around you. You can sub it out. You can have other things helping you remember, and you don't need to then be focusing on it. And these things will help alleviate some of the anxiety around, oh, wait, I don't know when I need to do that, or I'm worried I'm going to forget to leave the house for my appointment. Planning ahead and setting up alarms, calendar reminders, all those things can be really helpful. Using the technology and the strategies that are available to us right now, getting some of those systems in place can be really helpful. Making it clear, the other thing, like we were talking about with attention, minimizing distractions, creating that environment that supports you being able to focus in some way, whether that's the headphones or being in a separate room, maybe from where there's noises, decluttering, things like that. And rehearsing information, that practicing idea, repeating things to yourself, hearing it more than once, saying it out loud and listening to it and thinking about it. All those things are going to help further ingrain and deepen that learning of things that you're doing. So this could be as simple as helping to rehearse something you need to do later, where you're like, oh, I'm really worried that I'm going to forget to put the trash cans out tonight. Okay, say it out loud. Put the trash cans out. Write a note. You're writing it down, multimodal. Say it, picture in your head a trash can and picture it going out. Use all the different things available to you to help your brain further encode it in a richer way, in a deeper way, so it knows that that's important for you to do later. So there's lots of different ways you can use. It could be something simple, or it could be, if you're studying for a bar exam, it could go all the way up to something complicated, but it could just be something as simple as, I want to make sure I get the trash out tonight. Making it clear, asking clarifying questions. It's okay to ask other people to repeat information. If you missed something or you missed someone's name, it's okay to ask them to repeat themselves, or for you to maybe repeat it back for clarification. Like, is this what you said, or is this what you meant? That process of that back and forth with that helps that consolidation. It's helping to organize the information so that it gets in there. Like we were just talking about, the multi-sensory, multimodal, being able to listen to things, say it, write it down, visualize it, practice it, actually doing it. One of the strategies that I teach a lot of folks is to stop and think about something, periodically checking in, stop, think about where your attention is, think about if your thoughts are somewhere else, notice where your thinking is, notice if you're on track, have you gotten off track. There's a sort of stop technique. The reason I'm saying this, in addition to we should all do the stop technique, as I oftentimes say, literally put your hands up and stop yourself and say, stop, I need to stop and think right now. And that will help you remember it. Also, for that reason, it's multimodal. It's using now a physical sort of embodiment of this thing that you're doing, and it's using your brain in a different way. It's going to help with deepening that learning and getting that practice in a way that you'll remember it later. Make it organized. This is that idea again of the consolidation. We're getting the attention piece is helping bring it in. It's encoding it, consolidating, and storage. We want to be able to take the information and digest it in a way that makes sense. We want to put it in our little file cabinet, my little Dewey Decimal System, my card catalog, put it in there in a way that will make sense where we can find it later. So it's organized in a way that we can access it when we need it. So organizational tools are a great part of memory strategies so that it helps information get in a way that you can find it. And also with that idea of offloading things that you don't need to be holding on to tools around you, using external strategies. We really put a lot of pressure on our brains to do a lot for us. And we have all these tools at our disposal to use. Let's use them. We're asking our brains to do a lot. Let's use some things and take some of the load off of them so they can think more clearly. One thing might be having a centralized whiteboard. A lot of people like this strategy. It's something you can put up, especially if you have a family or multiple people in your house that need to remember a bunch of different things. It can help make it clear to everyone who's involved what needs to get done and when. It makes it less likely to be confused in the communication. There's multiple people able to check it so that nobody misses anything. And it's visual too. A lot of people can be really visual learners. So it's kind of looking right at you. You don't have to go somewhere to check it. So that can be really helpful so that you can see it when you walk into a room, into an area where you're pretty frequently in that space, looking at it, checking it daily, making sure it's updated so you have all the information on there. And I think it helps with reducing confusion around everyone has different calendars and things if it's all centralized. Another thing to think about is just a system, whether or not it's the centralized board or not. That's not the system that works for everybody, because the pros and cons of that, it's there, it's where everyone can see it. It's not going with you to the doctor's office. So you do want something like a system, like a daily planner, using your phone. Jonathan will talk about how he uses his a little bit to do maybe calendars in that, or if you want to do hard copy stuff, having a notebook with you or a daily planner where you write all your appointments, you write down notes as people are telling you important things you need to remember. You keep information you need in there, like your medications, insurance cards, things all in one spot, and always know where that is. That is always on you. If it's your phone, if it's your notebook, whatever it is that you do, have it all in one spot. This is part of the issue with things like Post-it notes. Post-it notes, you stop seeing them because you start putting so many of them around that you don't even really notice they're there anymore, because now they were supposed to be something that was supposed to alert you to something important, and that's supposed to stand out. And now if you have several of them, no longer is anything important. It's just kind of background noise. So having a system where everything is in one place and it's something you review daily and it's in an organized way, that helps bring your attention to it in a different way than having something that becomes background, if that makes sense. So then using a Post-it note for literally the most important thing, maybe like if you did need to make sure you grabbed something out of the freezer or something you can't prepare for ahead of time, I'd make sure I grab the ice pack before I leave. Boom, put that up on the door before you go. Something that you only use the once, not something that's long term that you're going to, the Post-it notes will start to fade into the background. Having a system, the phone, the planner, whatever it is that you check daily, you update as things come in, and you develop a habit and a consistent routine, that's ultimately going to be your biggest friend in memory. So getting a system on board. That system is different for everybody. A lot of people are liking using the phones right now because they go with us everywhere. Great. There's lots of different apps that you can use for it. Some people like the notes, some people like Google Keep, some people like all sorts of different stuff. Great. Whatever you want in that, whatever you're willing to do consistently, that's going to be the thing you should stick with. Try it out, try different systems out, see which one works best for you. Creating assigned places for items. This is where having the phone might be, this is the pros and cons of it. If you don't have your phone in a spot where you can always find it, then that system's not working for you because you can't check it to see if you have an appointment that day because you can't find your phone. A lot of people struggle with this, the finding of the phone, the keys, the wallet, all that stuff that gets sort of put down and misplaced. A lot of times that is related to attention. You're not paying attention when you put it down to begin with. So again, that information doesn't get in. It's not even in your memory to pull it out later. It's just not even happen. You're just guessing now where things are. So that attention piece can help with this, but really to take the complication out, make this easy for your brain, plan ahead and have a spot that out of a habit, out of a system, you put it every single time. I can always find my phone right here. I can always find my keys right here. That's where they always are going to be. It'll take a little time, a little effort on the front end to develop that system and get in the habit. But we actually, as human beings, are really good at developing habits. We're really good at changing these kinds of behaviors. It's just getting in the practice of it. Starting to do that and making sure it's all in the same place, making sure your family members or people know that's where it always is too, helping to reinforce that with everyone can be really helpful. Let me check out the other one here. Okay, yeah, so the calendar, the same idea. Within your phone, it could be the calendar there, or maybe instead of a whiteboard, you like actually having a big, like I used to have the kind that you put on your desk, like the big kind of calendar. I used to put that up on the wall and I'd write appointments in that, similar to like a whiteboard, but more of a full calendar sort of view that's right in front of you. If you like that, great. Maybe you even take down, if it's a small calendar, take that to the doctor's office. Again, great. Whatever is super helpful for you that you can take with you and be checking every day, whatever is consistent for you. The phones are nice because you can set those reminders. And I know Jonathan will talk about too, like if you have something like an Apple Watch that connects to it, then the reminders will go to your watch as well and can cue you to leave even if you're not sitting right by your phone, things like that. When you're talking about organization, the other thing to keep in mind is that trying to get it into your file system and your memory is keeping things organized. You want to try to group things together as well as you can for it to make sense to your brain and for you to be able to pair things in a way that will help you later. So you might associate, or you might, if there's something already you're doing, like let's say, you brush your teeth at certain times of the day. There's a habit that's already really, really well developed and you need to start something new. Maybe you want to start doing the mindfulness, for instance, or you have a new medication you need to take. Pairing it with something you're already doing can help because that's an already established routine. You're grouping it together with something you're already doing. So maybe you start doing you brush your teeth and you sit down and do a mindfulness activity, or you put your pills next to your toothbrush because you'll go there first thing, things like that. Also, organization and grouping things together could be things like mnemonics. I don't know how many of you remember Roy G. Biv, if I say that right now, with the different colors of the rainbow. Acronyms, things like that could be helpful. It's just a way of organizing information for your brain to be able to take it in a way that it can find it later. So that other thing on that is to think about categorizing things. There's a term we call chunking. So if you chunk bits of information together and group them with things that make sense, like, oh, these things go together, these things go together and these things go together, and you remember them by their categories, chunking them in some way, or chunking them by breaking them into smaller groups, that can be a really helpful strategy in taking in information and remembering it later. So there's an exercise I want to do for that, but maybe I'll pause for a moment and have Jonathan, if you don't mind, maybe talking a little bit about how you've been keeping organized and helping with your memory and being able to start your systems, implementing some of your systems, what's been helping for you?
Sure, thank you. A really big thing that has really helped me out, and again, it's upfront, as she said, building your network and building your system of how you want to remember things externally is really important. And how I do it is I use my amazing iPhone and my Apple Watch, and that is I talk to them daily. You can actually just talk to your phone. Like right now, I can say, "Hey Siri, make a note to take my medicine at 8 o'clock." And so it just put it at the top. I'm sure you can see it. It just made a note, and a timer will go off, and it'll tell me that I need to take medicine at 8 o'clock. The other really cool thing is that with the Apple Watch, they now have what's called a pill timer, and you can set all your pills on your Apple Watch. And my Apple Watch will vibrate when I need to take those pills at all times. And one of the things that I did to be able to feel more comfortable with spending the extra money on the Apple Watch is that I asked my doctor to write a prescription for it as a medical device. So I was able to write it off on my taxes. So that was a really, really big thing for me. You just need to ask them to write it as a medical device. Essentially, it works as a very high-end medical bracelet as well. You can input all of your medical ID. It's a medical bracelet ID for your age, your birth date, your height, your weight, what you're allergic to. All of those things go into your medical ID, and no one has to be anyone. So if if you have a seizure and an EMT finds you or someone finds you on the street and they call the EMT, the ambulance shows up, and you have an Apple Watch on, or you have an Apple phone, all they have to do on your Apple phone anyway, hold on, your Apple phone, they would, EMTs and doctors already know to do this, but they would just hold the two side buttons, and you should be able to see where it says medical ID. They will slide that over. I'm going to try to do it they'll slide that over, and I typed in as much information as I could about myself. It even has all of my emergency contacts of people that I've listed as my emergency contacts, my best friend, my partner, my mom. All of them are listed, and they don't even have to open my phone or know my password to get into my phone. They can just call those people. So if someone finds you on the street passed out or something, the EMT, they know that EMTs are already trained to do this, and doctors are already trained to do this with iPhones. So it's a really huge help. The Apple Watch does the same exact thing. And so it's really helpful. I can definitely attest to the Apple Watch with fall detection. We gave an Apple Watch to our dog and cat sitter in October 2021. She is 65 years old, and she has heart arrhythmia, and she had stepped on a step stool. We were gone for 3 days in the Grand Canyon, so we had no cell service. She didn't have her phone near her, but we had given her the Apple Watch and set it up for her before she left. She stepped 2 steps up on the little step stool to pull down the shade, and she fell backwards. She hit her head and broke her femur. She was bleeding, and she had passed out. The Apple Watch asked her, do you need help? She did not answer because she had passed out. So it sent a location alert to the 911 center, and it texted all of her emergency contacts with her location. It just so happened, a blessing for us as a homeowner, It just so happened that her roommate was nearby, driving nearby, and got the text and drove straight to our house. She was able to let the ambulance people in instead of them breaking down our door. Otherwise, our friend Holly would have laid there for days. So those are really good things to have, these devices, for more than just your memory. It's just those kind of things. Another thing that I use for myself externally is I now use what a lot of European men use. You women are going to understand this especially, but it's just called a crossbody bag. It just kind of crosses over me, crosses over my arm. And so I just have my bag here, and it's got zippers. It has my wallet. It has my keys. It has absolutely everything in it. Every woman understands this. It's as a man, I didn't really understand the need for this until now. And it's so wonderful to walk out of my house to go see friends or whatever, to go to the store, and my keys, my wallet, everything are in there. The other thing that I just bought, I haven't gotten it yet, but all my friends have told me to buy it, is I got the air tags. They're $29 and they connect to your phone. So essentially, I may not even ever have to remember the mellow yellow code, because the AirTag will find my car for me. And the other really cool thing about the AirTag is essentially when it's, when it's in your car or whatever, and you're trying to locate your car, you'll be able to, and you could be miles away, but you'll find where your car is in the exact location. I even ordered an extra one for our indoor-outdoor cat that can actually go on his collar. So we'll be able to find him, whenever he runs away, we'll find him which neighbor's yard he's in. So those kind of little things to kind of help you out are really important. I wish I could speak towards Google and Android. I'm sure they may have some other devices of that nature, but those are the things that really help me the most, because after my second brain surgery, my handwriting abilities aren't that great anymore. I lost a little bit of my right hand abilities to be able to hold a pen very well. So it's been very helpful to be able to talk to text. So that's the other thing I do, is I can say, hey, text Mark Fredson. Hey, Siri, text Mark Fredson. And it should say, yeah. And then it just starts typing what I'm saying right now. And then I would just have to hit send. And so those kind of things are really, really helpful for me. So I hope that helps each of you. If you have any more questions, just let me know.
That's awesome. Thank you so much, Jonathan. Really helpful tips, and the safety aspects to some of those tools as well that maybe some people aren't familiar with yet, or maybe if you have the watch or the phone, you haven't even set up yet because maybe it was an option. So I really appreciate you bringing attention to that. That could relieve some anxiety. Yeah.
One more thing is just that I forgot to share, I shared with Melissa earlier, is for those that are a little skeptical, we got my grandmother the Apple Watch and an Apple phone, and she is in her 80s. And of course, she was really nervous. She had had an Android phone forever, and it was kind of falling apart. Well, the great thing is the Apple Store teaches classes for free. And so you can go on the Apple Store website and to your specific location and look what classes they're teaching for that day. And you just show up and they will help you and they walk you through everything. And my grandmother, Peggy, absolutely loved it. She had such a blast. And now she knows more about the Apple Watch than I do, which is really funny.
I love that. Well, that she's schooling you on Apple Watch.
She is schooling me.
That's great. No, and that's a great resource too, to think about, that you could have someone really actually get you comfortable with these tools too, if they sound intimidating up front in some way, that there is help for that. And I think you'd mentioned earlier too, there's a lot of YouTube videos that can go through a lot of these tips as well. So thank you for that. So yeah, so Jonathan's system of using technology and the watch and the phone all works together, also connects to, I believe, the iPad, like the whole system kind of works. That's like it's a real system in that way. I really appreciate too you bringing up the bag, the idea of having everything on you. I know some people I've talked to, especially I think men sort of culturally, because we don't necessarily always have a bag, you're not used to doing that, putting the wallet in the pants and then the keys in this pocket and then something else in the coat pocket like things get scattered or left in a closet or somewhere, and having everything in the one spot, even if it's not a bag, having a place by the door that you always keep it, or something else where it's all in one spot, can really eliminate some of those opportunities for cognitive slips or forgetfulness to happen.
And I'll say this for
Yeah.
you men, one of the things that I did that we were talking earlier is being able to share with your friends. When I shared with a lot of my male friends that, gosh, I'm carrying this bag, you know, I know they do it in Europe. Most men carry them in Europe. But I was like, here, you know, I just don't want to feel too weird. And so a lot of my male friends started carrying a bag because I started carrying a bag just to make me feel more comfortable. And now they've become addicted to it. So it's kind of cool. I'm hoping maybe we started a trend.
Yeah, you're spreading the news about it. First, it's been all my life. That's great. That's a really cool thing to remember too. That maybe utilizing your social system around you to help support any of these strategies you're using can be really helpful in getting them started. I did want to do. I'm aware of the time. I want to make sure we have time for questions and everything too. So we'll briefly do this. I had done an exercise to sort of talk about a little bit how organizing information can make a difference in how you remember it. So I just wanted to bring that up really quickly. So just if you want to play along, you can. If you don't, you do not have to. It's fine. I put up a list here of different things to remember. It's a little grocery list. I want you to kind of take a look at it if you want to play along, and just try by looking at it to remember what's on this list. I'm just going to give you a second to read through all of it. Try to remember what's going on. Try to see if you can remember this. Now, if this was a grocery list, again, going based off what I said earlier, I would want you to write it down in some way, have it in your system so that you can check it when you get to the store. But for this purpose, I want you to kind of look and see if you can remember these. Okay, give you a minute to look at those. Now try to think about, what is it you remember? You can jot it down, just try to recall it briefly from that list. What is it you remember right now? How many words come back to you? And now I want you to think about it this way, with that idea of grouping things together, chunking information. I want you to group similar things together to organize it. We want to organize information. So again, here's that list. Try to group it into 3 different categories and try to remember the list that way, broken down into those 3 different categories. Okay, so thinking about that, now what do you remember? Are you noticing that helped you remember any more words? Was it easier to recall them or think about them now as now that the list is not up there? Is it easier for you to think about them if you have the 3 categories? Sort of notice if that was easier or not for you, or did you naturally do that? Some people, you might think in this kind of organized way to begin with. Maybe you did that already. Some people, this is a new strategy. So I wanted to bring this up because it can be really helpful in thinking about organizing information as it comes in. If you're able to group it in some way, when you go to retrieve it, like I just asked you to do, I took the list away. I'm saying retrieve this information now, pull it back up from your long-term storage, go into that card catalog and grab the thing that you need. If it's grouped into certain categories, you're more likely to find what you're looking for. So this is what you likely grouped it into as you were doing that. There was these 3 categories that were sort of already on the list. There was frozen foods, there was condiments, and there was these toiletries. So if you sort of group them into those categories, you were able to remember more of the words from the list. I wanted to kind of check in with Jonathan on this one too, because I know that this is a strategy we talked about a little bit in our work together. And I don't know if you wanted to walk through a little bit the process you have with trying to take in and organize information like this, Jonathan.
Yeah, so this is how I looked at it. It was frozen food, condiments, and toiletries. For me, I when I was looking at the list earlier, I thought, gosh, what do I want to put in my freezer that I love to eat dessert for hot days here in San Diego? So I thought of the 2, popsicles and ice cream, constantly. Everybody wants a frozen pizza in their freezer, just because it's a staple. As for condiments, whenever I saw the condiments, I immediately thought, gosh, I really want a burger. What are the 3 liquid items that I put on a burger, and that's how I remembered. For the area with the shaving cream, soap, and toilet paper, I just thought of, okay, I need a shower. What are the things that I need for a shower that are most important to me? I like a clean shaven face, and I like soap, and I always blow my nose before I get in the shower. So that's just kind of like how I thought about it when I was looking at the list, and it really helps.
Yeah, that's really helpful. I think you're pointing out a couple other things that you can do too, is you're visualizing. I can see that you're sort of visualizing, oh, I would go to the freezer, I would open it up, I would see the pizza in there, I would be in the bathroom. Oh, if I'm in the shower, I normally have my shaving cream here, I have my soap over here. Visualizing things using sort of spatial, actually walking through it in some way, and spatial memory in that way. A lot of times people, for grocery stores in particular, going through a certain path each time, so you're hitting certain areas, can be helpful. Organizing your list, maybe not by category then, but maybe by location, whatever makes sense to you. Just having an organizational structure to it can be really helpful. But I think that visualization is a really nice add to this as well, and something we haven't really covered yet. So thank you for that, Jonathan. I appreciate it.
Remember, just allow yourself, feel comfortable to sit in your car, feel comfortable to sit on a bench before you walk in a grocery store, to do what she said of visualizing each room, walk through each room before you walk in. And I now understand why I see people sometimes sit down outside of a grocery store or sit in their car for a little bit before they get out. I'm now realizing that they may be doing that very same thing. So it's kind of very comforting for me to feel I'm not alone in it.
Yeah, that's a great point, actually. And being able to stop and sort of gather your thoughts. Oftentimes for things like errands, we're out running around doing a bunch of different things. We're multitasking. We're doing that thing that we know is challenging for us to do. Being able to stop, like I mentioned earlier, take a breath, come back to the present, get your attention and your focus on what you're doing right now, get that attention piece. Being able to plan ahead, think through, and organize yourself before you do the actual thing you're going to do, whether that's grocery shopping or anything else, can really help then actually getting that task done more effectively. And so you don't forget things while you're there. Which a lot of people will say, even sometimes with the list, there might be something forgotten because you start to get distracted, or you're feeling frazzled, or something might happen. So getting present, getting your attention on board, having a plan before you even step into the store where there's a lot of distractions, noises, things that might make it harder for you to think clearly. I think that's a really good idea. That's a great tip. Additional memory tips, sort of above and beyond what we talked about in the, or maybe it's not outlined in the same clear way in the handout we put together. I just wanted to point out some things that people have told me have been really helpful in different settings, just some kind of concrete tools. Recording things. You may ask during appointments, for instance, when you go into your neuro-oncologist, is it okay if I record this appointment? I have some trouble with writing, maybe you're having some trouble with writing. It's hard for you to take notes, or you might, be concerned that there's a lot of stress in those appointments that you might not remember it later because you're not thinking really clearly under that kind of pressure. So that might, like things like that, doctor's appointments, you might ask if they would be okay with you recording the session. Recording Zoom meetings like we're doing right now. You could ask, for instance, if you're in a work setting and you're having a meeting and you're like, I'm really worried I'm going to miss something that I need to follow up on, and people are talking really quickly. Oftentimes, like we mentioned at the beginning, if there's some more sluggish or slow processing speed, people are chatting choo-choo back and forth. There might be something you are worried about slipping past you, and having something you can go back and look at, whether that's actually recording a video, or there is the transcript feature in Zoom and these other kinds of video functions where you can reference something. So again, it kind of helps you know that there's something you can look back on that will help jog your memory, having some sort of reminder of what you guys talked about, or if something did get past you because maybe it was going too quickly, that you're able to rely on an external source to give you that information. Visual reminders, like I mentioned, maybe putting the Post-it note for the one thing you need before you leave, maybe doing something like that. And one thing I've talked to some people about that can be really helpful is creating, again, a habit of making doorways a time where you stop and check in with things. So especially that front door, before you leave to go to your car, leave the house, whatever you leave to go do, stopping yourself, stop, check in and say, what do I have everything I need for the day? Taking a pause. Again, it's going, one of the broader tips is to reduce pressure situations, not being in a rush, planning as much as you can ahead of time to not feel like you're rushing out the door to things. So if you have that moment to stop, bring yourself back to the present, focus on what you're doing, not thinking about the 6 things that you're thinking about, but coming back to what you're actually doing, and notice, okay, what I have my bag. What's in my bag? Did I get my phone? Did I get my keys? Did I get the things I was going to bring with me to this meeting or wherever you're going? Did I grab my grocery list? Do I need an umbrella because it's raining, whatever it is? Go and use that door, look at the actual door frame in itself as a reminder, use that as a visual cue, as we would call it, that you might need to check in, and before you leave, make sure everything's in place so that you leave the house with everything you need. I've talked to some people, they would leave, maybe they needed like tools for a job site they were going to or something, and they get there, didn't have the tools, came back, grabbed stuff, got there, still didn't have the tools, went back, and there's this sort of back and forth that can happen, leads to a lot of inefficiencies and some frustration. So that check-in process can be really helpful. You might think about that for doorways, or other people I've talked to have used the stairs for this, making sure that before you go up or down the stairs, especially because going up and down the stairs all day, if you're being forgetful and not getting what you need from one flight to the other, that's a lot of extra effort. So before you go down the stairs, checking in, okay, did I get the thing I came up here for? Yes or no? Did I get distracted while I was here? That's possible. So did I actually get my glasses on the nightstand like I meant to? And the other way around, okay, when I'm going up the stairs, what am I going up there for? Okay, I'm going to go grab my medications. Saying it out loud so that you don't get distracted. Medications, go get the medications. Speaking of medications, using a pill box. I cannot tell you how helpful this is. If you are not on the pillbox train yet, come join us. Join us in the pillbox. It's so lovely. It's very comfortable here with pillboxes. It is such a great tool. It's something I think a lot of people can hesitate starting. If you haven't started already, I highly recommend, because it really lessens anxiety around medication. If you know that you have everything in that pill box, and that when you go to check it, if a pill is in there, that means you did not take it. Or if the pill is, if it's in there that you did not take it, or if it's not in there that you did already take it, that's going to reduce your anxiety around forgetting a medication or taking it twice on accident, any of the stuff that can happen with mismanaging sort of the medications. So highly recommend that specific tool. Pill boxes are great. And also around medication in particular, this happens with a lot of people. They'll maybe have like the cool alarm that Jonathan just talked about, maybe on their phone or on their watch, where you're setting up, okay, I take my pill at this certain time. But maybe that alarm goes off and you're in the middle of feeding the dog, or getting your kid ready for a bath, something like that. You're doing something else. You turn off the alarm and then you forget that you didn't take your medication. This is hard when you have a lot of stuff going on. This one's a hard one, but one thing that can be helpful is that you're not allowed to turn off your alarm until you take your medication. Whether that means you have to listen to it now for 3 to 5 minutes while you finish the task might be a thing, but that you're not having that habit be that until I actually take the pill, swallow it, and finish the task, that you're not allowed to turn it off, so that it will continue to remind you until that task is done. So that's one thing that has helped people with that disconnect that can happen with the alarm, and having that system not work as effectively as it could. If you notice that, maybe try that one. But just in general, setting up reminders, alarms, anything you can do, utilizing things we haven't even brought up yet, using your using your smart devices or like your Google devices to set timers for you. Maybe you're in the middle of cooking something and you're worried you're going to forget you have something on the stove. That's a really common experience as well. Setting either a timer on your phone, watch, all things we talked about, or you could have Alexa, setting a timer, set a timer for me for 10 minutes, so that even if you are there and cooking and remembering to do it, it's fine. It's just a backup. But if you get distracted, if something happens and you move away from the stove, then this alarm is going to say, hey, don't forget you have something on the stove. So utilizing the tools you have around you to kind of keep you on your task in some way, and be sort of preventative in case you do get off task in some way, that it will help bring you back to what you need to do. Automate what you can. A lot of people I talk to have done this already. If you haven't, it's another good tool you could tap into. Set up automatic billing, anything that can be automated. So again, it gets off of your plate. You don't have to be thinking about it all the time. You don't have to worry about missing a due date. It just automatically gets done for you. Fantastic. Whatever you can sort of take off of your memory, great. And then using navigation systems. This might be just a backup, just having a navigation system on when you're driving around so that it, maybe pulls your attention in when you might need to make a turn, something like that, turn off the freeway. In case you're starting to get distracted in some way. A lot of us go into automatic pilot when we're driving. It's a really common experience. So we might not be paying as good of attention as we think we are. So having navigation systems there to like chime in to let you know what the next step is, or in case you do feel like, I'm in this neighborhood and I'm a little more, I don't remember quite as well as I thought I did how to get to this place. I've only been a couple times. Just having that as a backup could be helpful, really keeping you engaged in the driving at that time. And then very briefly, I know we're running out of time. I apologize. We'll have a little time for questions too. We're right at the end here, but I did want to point this out that even with all these strategies, there are best laid plans, all of our systems we put in place, nothing works 100% of the time. And so having a lot of self-compassion and have a plan in place, remaining calm if something doesn't quite go to plan, having a plan in place as to what you're going to do in those moments, because cognitive slips are going to happen. All these things we're talking about, these strategies are to help you manage them. It's a management plan. We want to plan for that these things will happen. How do we reduce the likelihood of it? And how do we create systems and tools and things we can do to help when we know these are more likely to happen? How can I prevent them in some way? And how do I make sure that I have things in place that will help me in these areas I know I'm more forgetful. But even with that, for instance, like I was talking about, sometimes you turn off the medication alarm and you haven't taken your medication. So what do we do in those moments? Staying calm, having a lot of self-compassion. This is hard. Cognitive changes are really, really challenging. And even with everything that we put in place, there might still be some slips, and that's, we're human, and that's something that that is expected, especially with this particular disease, and something that, you're doing your best, and we know you're doing your best. And I know that's something I talked with Jonathan a little bit about earlier. I didn't know if Jonathan, if you had some tips around this as well.
Yeah, it's essentially forgiving yourself and just being kind to yourself, and just do your best to stay as positive as you can. And those can be hard when we have our headaches or we're not feeling well. And it's okay. You'll actually find that those that really love you, or they'll be there for you and kind of sit with you. And just remaining calm is also really important. I know that I used to be a lot more high strung than I am now. And I really think that being calm, and being able to tell my friends, oh my gosh, I think I'm having an anxiety attack. I'm really, that they can kind of sit with me and like rub my hand or stuff like that actually really helped, because being open about this has really helped me, I believe, in my process. So really dedicate time to keeping in touch with your support system, and keep them notified, and let them love you.
That's wonderful. Thank you. That's a really good reminder, Jonathan. Thank you so much. And thank you for everything that you've shared today. I'm just going to kind of summarize really quickly. I know again, we're running out of time. I plus I went a little bit further than I thought I would. I wanted to make sure I got all the information in today. So just that this is really a common experience. Forgetfulness, memory changes, thinking changes in general can be really common with brain tumor and everything that comes along with it. Really thinking about how to leverage your strengths. What are things that tend to go really well for you? What are things that have worked for you in the past? How can you do more of that? Writing things down, developing a system in some way that helps keep you on task, that documents things you need to, so that you're not having to hold all of that in your memory. Really utilize those systems to make habits and routines of things that takes the effort off of you and your memory. Designate places to put things, get that habit up and running, and make that something that you stick to. Slowing down, taking that, stopping and taking a second to think, repeating things as you need to practice, to rehearse it, get it organized and put into your brain in a way that you can find it later if you need to. Organizational strategies could include, like the calendar or the dry erase board, other tools maybe you haven't tried yet. Maybe there's something else you could try and see if it helps add to the system you're in, or continue to fine tune the system that you have currently. Consider talking with other members of your care team, your treatment teams about resources, further support that might be available to you if you do feel like you're continuing to struggle, or that you feel like you might need someone else to help you in planning some of these things. Talk to your neuro-oncologist. I know sometimes people join this group, I believe, that aren't necessarily always associated directly as a UCSF patient, if I recall correctly, or people are watching online later. Resources that I provide for the cognitive rehabilitation through neuro-oncology at UCSF is only available to UCSF patients in California specifically too. You need to be sitting in California when we work together, but we do have telehealth options. We don't necessarily have you come in person for all of it anymore, but you need to be in California. So I also just want to bring that up, that this is a resource we have here, but there are other types of resources that might be in your area if you're not local to this particular area as well. But it's good to ask your medical team for some of those ideas as well. And I do know, thank you so much for your patience with that. I'm going to bring up my email. You can reach me that way if you need to, the website for where that strategies manual is. And here's a QR code if you want to go straight to it. I did see a few questions in the chat I wanted to just make sure I address before I kind of open it up. I did see about, there was a question about neurofeedback. I'm not as familiar with neurofeedback. I apologize. That's, I guess, another subspecialty that is not sort of within my wheelhouse. I have heard some people mentioning it more and more recently, so that there might be some more research in that that might be helpful. I don't know about it for cognition specifically. What I've heard it used for is more in the context of managing stressors. So learning feedback around when your stress system is high, you're able to see physiologically that your heart rate is up, and learning strategies for reducing stress. So in that way, I could see if you're able to reduce stress and feel less under pressure, you could think more clearly. So there could be that piece of it. I don't know beyond that how it necessarily helps with cognition. So I apologize, I don't have a lot of information on that. Let's see, let me see what else. There was another question about, being able to tell whether or not the cognitive changes that you're experiencing are related to the brain tumor versus, kind of average senior moment related to age in some way, or, other conditions, which I've seen also. I would say that it's hard to tell. And it's one of the things that as neuropsychologists is our specialty to do through our testing process. We do compare your performance to your cohort of people of similar age and education, so we can see, is there a difference above and beyond what we'd expect for your age? So that's one way we tell, is that our testing is able to detect that. How you might be checking on it just sort of on your own is kind of comparatively with your cohort. If you feel like your functioning feels like you're having a much harder time than other people your age, you might be like, I might want to check in with my doctor about this and see if there's other resources or neuropsych testing I could do. But it might be a matter of checking in with them either way if you're really concerned about it, just to make sure that that's but we can, as neuropsychologists, we can tell you we think this is more related to the brain tumor than it is or this is just age related changes. So if that helps answer your question. And then I apologize. I know we're pretty close to running out of time here. We're right here at 8 o'clock. I know that there are I'm seeing a question about neuroplasticity, diet, memory, things like that. We have some other really great videos posted on the UCSF brain tumor website under these Living Well video series that this is going to get posted under. There's one specifically about neuroplasticity. There's several about diet and exercise and brain health, things like that. So I would say you might go back and reference those because they're going to get into it in a lot more depth than I could right now. But we've got some experts on there in that field and specific to brain tumor. But if you haven't seen them already, really, really highly recommend all of those. And then I see a question about psilocybin. I apologize. I really don't have expertise in that. So I'm not going to be able to speak to that directly. I want to say there might be something about that actually on the website. Now I'm saying that maybe Naomi could correct me if I'm wrong. There might be a video on that as well, actually on the Brain Tumor website.
Yes.
Not in the context, I don't think of, is it in the context of memory or in something else?
It's not in the context of memory, but there is a webinar that we did on psilocybin.
There is, right? Okay.
Yes.
Yeah. So that might be, if you haven't checked that out, that might be worth looking at and see if that answers some of your questions. And if not, then maybe continuing to ask your medical doctors if they have some other resources as well.
If someone can
Okay, so I know we're right at time.
If someone can post where to find that, that would be great.
Good. I'll post that, what that website is. Naomi, do you have a link to the
Yes, I'm just grabbing it now,
page?
and I'll put it in the
perfect.
chat, and we'll put it in the follow-up email as well.
That's a great idea.
It's on YouTube under UCSF Neuroscience, I believe, is where the video on psilocybin is, and it interviews one of UCSF's patients. UCS.
Oh, does it really?
Psychology. Yeah, yeah.
Oh, that's great. All right. Well, thank you so much for joining me, you guys. I know I went a little over time. There's not a ton of time for questions. If you guys want to hang in for a few more minutes, I can hang in if you have some more questions you want to ask me directly. I really appreciate your patience and your time with me today. Does anyone else have any questions or things they wanted to discuss before we wrap up?
And I just want to say thank you so much, Dr. Brie and Jonathan, for being here and just sharing just a wealth of information and tools. So thank you so much. Really, really helpful. I'm going to stop the recording now.